I'm Alex Johnson, and straight ahead on West Virginia Today, this time last year, there was a COVID-19 surge where 181 people were hospitalized at WVU's hospital right behind me.
I'm Laura Bonatesta, and straight ahead on West Virginia Today, I'll tell you how peer recovery coaches are using lived experiences to help others get better.
WVU School of Public Health is celebrating its 10-year anniversary, and during the COVID-19 pandemic, it was a resource for West Virginians during a difficult time. I'm Bailey Tucker.
And I'm Sean McAllister. The pandemic has had a negative effect on the diagnosis and treatment of diseases. We'll have a statewide expert discuss what you need to know living in this post-pandemic world.
These stories and more coming up on West Virginia Today, a public affairs show produced by television journalism students right here at West Virginia University.
During the COVID-19 pandemic, West Virginia University's School for Public Health was called upon by the state to help lead through the crisis.
That's right, Sean. The school's more than 300 students helped create protocols for West Virginia, such as how to track the disease and help combat the spread.
Reporter Alex Johnson and photojournalist Benjamin Powell show us how public health has evolved during the last decade.
The importance of public health and the contributions of the School of Public Health here at West Virginia University.
Dr. Jeffrey Coben has been with WVU since 2004. He is the Associate Vice President for Health Affairs and Dean of the School of Public Health. And during the pandemic, the state relied on his school to help lead its response.
We helped with developing the data that went into school maps, county maps on the frequency with which COVID was occurring. And the governor and his team, Dr. Marsh and others, used that data to help make those decisions.
WVU's School of Public Health was one of the first in the country to create a training program for contact tracing to monitor the spread of the disease. They trained more than 100 people to conduct this tracing statewide. They also created a network to share information with West Virginians about the importance of the vaccine and wearing masks.
I really do think that we've made a positive impact. I think that our students have been out there helping people get vaccinated, getting information out to people. We've had faculty members who've actually worked with the health departments hand in hand to get people vaccinated. So I think we've made a big difference, and we're going to keep working on this.
Coben's team helped administer more than 2 million doses of the vaccine to West Virginia residents. The state was the first to have all of their first responders completely vaccinated, and his team was part of that success.
I think that what I'm most proud of is that collectively, all of our students, all of our faculty, all of our administration have really gone out and been the voice for public health, made people understand that we're in this together.
Coben says the pandemic response allowed his students to get first-hand experience. After 10 years, the School for Public Health offers a master's and bachelor's degree, but administrators say that there's an increased interest, and classrooms like this one will soon be filled with a minor in public health too. Peyton Shreve is one of those students. She says she's majoring in public health because of COVID.
Public health wasn't even a thought in my mind until the pandemic, until I realized how important it was to, our economy and our health and just, everything. Public health was at the pinpoint of the pandemic.
WVU has one of the only programs in Appalachia, and Shreve says that persuaded her to even attend college in the state.
I think I really want to achieve some clarity in what I want to do, because I'm still not quite sure yet where public health is even going to take me. And there's just so many opportunities that the school provides. It's just exciting to think about.
Peyton says she doesn't know what focus she wants for her major and is still exploring what she wants to do in the future. For West Virginia Today, I'm Alex Johnson in Morgantown.
The WVU School of Public Health is the state's first and only accredited public health school.
If you live in West Virginia and want to see the latest COVID-19 infection data, visit the website at the bottom of your screen. The arrival of COVID-19 disrupted healthcare in various ways, Bailey. Less urgent services were canceled, and stay-at-home orders prevented some people from going to the doctors.
And even though the peak of the pandemic appears to be behind us, experts say the COVID-19 pandemic will have a long-term effect on healthcare.
Dr. Jeffrey Coben joins us now in the studio. Dr. Coben is the Dean of the WVU School of Public Health, and our lead story tonight focuses on the 10-year anniversary of the school and how the School of Public Health was a leader during the pandemic.
Dr. Coben is also the Associate Vice President for Health Affairs for the Health Science Center at the university. In this role, he is Dr. Clay Marsh's Chief Advisor on all matters related to academic excellence, scientific creativity, and the impact of WVU programs on health, and is the university's representative in activities throughout West Virginia that seek to improve public health and healthcare. Welcome, Dr. Coben. It's a pleasure to have you on the show.
Well, thank you. It's a pleasure to be here.
Well, Dr. Coben, I understand in this role you helped to lead the School of Public Health's response to COVID-19 by working with federal, state, and local agencies. Can you briefly explain to me that work?
Yes, well, the work was really built on the 10 years that we've had in developing relationships and partnerships at the local, state, and federal level. Locally, we worked really closely with our hospitals, with the Monongalia County Health Department, and providers in the region to stand up immunization clinics, to create the policies that we needed within the university to keep us all safe. At the state level, we worked with the Department of Health and Human Resources, with the Bureau for Public Health, on everything from giving information on where people could get vaccinated, how to keep themselves protected, as well as testing the wastewater to see where COVID-19 might be spreading throughout the state. And at the federal level, we work with partners, including the Centers for Disease Control, the CDC, to look at things like mask wearing in the university setting and the influence of different things on helping to improve masks. So really the foundation of that was the partnerships that we had developed over these past 10 years as our school developed.
Now, many people think that the pandemic is in our rearview mirror and we can resume our lives as we did before the pandemic. Is this true, and what health precautions should we still be taking?
Well, unfortunately, the pandemic is still with us. By definition, the pandemic is a global event. It's worldwide. And while things have been improving here in the United States and in West Virginia, we know there are still portions of the world where COVID-19 is very active. In these areas, that means that there are likely to emerge new variants. And those variants can again come to the United States and come to West Virginia. So we have to be very vigilant in keeping an eye on what's happening around us. More importantly, here we have to continue to act to protect ourselves by doing the things that we've learned over these last several years, including getting vaccinated, being up to date with vaccines, wearing masks in situations where you're needing to protect yourself or others, and by hand washing and maintaining safe distances in public settings.
Now, can you tell our audience how important is it for people to still get vaccinated and continue to get each booster shot they're eligible for?
Vaccines are really fundamental. They're extremely important as we move forward, not just for those of us who are adults, but even more so perhaps for children. As we think about how to really affect COVID-19 and its spread in the future, getting our children immunized is going to be one of the most important ways that we can have a long-term reduction in COVID-19 for the future. That'll be critically important. There are also really great advances in medications that treat COVID-19. So anyone that feels sick needs to get quickly tested, and if they test positive, to seek out information from their healthcare provider on whether or not the medications might be appropriate for them to take.
Now, when we talk about long-term effects of healthcare post-pandemic, is it business as usual, especially in rural healthcare?
It's not business as usual yet. We still have quite a ways to go. And there are a number of factors that are influencing that. First, we saw during the pandemic that healthcare providers themselves were extremely impacted. And as a result, we have a number of shortages in healthcare providers that are now impacting particularly some of our smaller community hospitals in rural settings. shortages with nurses, shortages with other healthcare providers, respiratory therapists. These are things that we don't often think about, but inhibit our ability to adequately staff our hospitals that do exist through the state. So that's going to be something that we have to stay attuned to. Also, there are many illnesses that were not occurring over the last couple of years because people were staying home, staying away from others. And now that people are getting back into community settings, we're seeing more and more of that. And a great example of that is the RSV virus that we're seeing in children now, which we've always experienced RSV outbreaks on an annual basis. But now we're experiencing 3 years of that in a combined way, hitting us all at one time. So these strains are going to continue to exist within the healthcare system, and we're just going to have to continue to work to reinforce that workforce and to gradually get all of us protected back to a pre-pandemic level.
Dr. Coben, it's obvious with all the new strains of this virus that coronavirus is here to stay. So what would you like our audience to know about living in this post-pandemic world in regards to their health?
Well, I would say a couple of things. Don't forget the fundamentals of taking good care of yourself and the people that you care about. That includes getting good rest, exercise, diet, avoiding tobacco, avoiding alcohol, being safe in your environment. As it relates specifically to COVID-19, vaccination is going to be key. Vaccination of ourselves, staying up to date, and as I mentioned, particularly for young parents, getting their children vaccinated. This next generation will be the generation where we can have the greatest impact on really eliminating the spread of COVID-19 if we effectively vaccinate each and every one of our children as they come into the environment and into the world. Continuing to wear masks in environments where you need to protect yourself or if you've been recently ill. And as I said, if you feel ill, stay home, get tested quickly, and seek out health care if necessary.
One final question, Dr. Coben. You're the Dean of the WVU School of Public Health, and you must be so proud because you guys were a leader during this awful pandemic. Is there anything related to COVID-19 that the public should know about your school?
Well, I am really proud of all that we've done, not just at the School of Public Health, but throughout the university and throughout the state of West Virginia, in the partnerships that we've formed to really deal with the crisis. As it relates to the School of Public Health, our focus really is on the workforce, developing the workforce that's necessary for public health now and in the future. We've had chronically, for quite some time now, deficiencies in the public health workforce at the local level, at the state level, and even at the federal level. And we need to reinforce that. We need to boost that workforce. So I want people to know that we have offerings at the undergraduate level and at the graduate level, all the way up through to the doctoral level for people that have an interest in public health. We are able to provide what we think is state-of-the-art training, and those are the people that can help us really strengthen the workforce in public health to deal with not just this crisis, but future public health crises that we may face as we move forward.
Well, Dr. Coben, thank you so much for coming on to West Virginia today. This conversation has been extremely informative for both of us and our viewers.
Well, thank you, and thanks for all you do.
Coming up after the break, we'll take you to a local theater that struggled to keep its doors open during the pandemic.
And we'll introduce you to one performer whose dream of becoming a Radio City Music Hall Rockette has been sidetracked because of COVID-19.
I'm Carly Miter, and straight ahead, I'll be taking you to an animal shelter where we are bringing awareness to our furry friends in need.
West Virginia University is a place where learning is an adventure, inside and outside. You'll become an innovator, a boundary breaker, an earth shaker. Choose your circle from 30,000 fellow mountaineers, and choose your path from hundreds of majors and minors. In a community that feels small, and you'll use this to get to class. You'll have room to find your people, your passions, and your purpose. Because we're a place where everyone fits. This is WVU. This is home.
According to the CDC, 13% of Americans started using substances as a way to cope with stress during the pandemic.
But for people whose drug use extends to a substance use disorder, a new program in West Virginia is offering support through experience with the disease.
Reporter Laura Bonatesta and photojournalist Tolu Olasaji introduce us to the program offering healing through peer recovery.
Jennifer Downey came to West Virginia Sober Living several times before she was able to find long-term recovery from her substance use disorder.
They never gave up on me. They've literally walked me through every step.
Downey says she wouldn't be where she is today if it weren't for the program.
I'm coming out of treatment and they offer me a job. Not only one job as a house manager, but 2 jobs. And it's not just a job, you know, it's a career that I love to do.
Downey is now the manager of West Virginia Peers, a team of peer recovery support specialists at West Virginia Sober Living using lived experience to help others get better.
You have a group of this population that is in recovery and they want to give back and they want to be philanthropic and they want to improve their communities. And the way they can do that is to get into this field.
Peer recovery specialists help connect people to resources including food, clothing, housing, and more, while they seek clinical treatment elsewhere.
Oftentimes, somebody with lived experience, it would be easier for them to have a conversation with that patient than it would be for that doctor or nurse.
A WVU study of West Virginia peers found that more than half of the people in the program entered clinical treatment, and a third remained in treatment for over 6 months. But during the pandemic, it was harder to make these connections.
It was very hard. Because, you know, we're trying to find resources for our clients, but you can't get in anywhere.
Specialists relied on virtual connection to help people stay in recovery. To get people through the pandemic, West Virginia Sober Living also scheduled vaccine appointments.
You know, I think there were a lot of ripple effects because of COVID, but I think this population is more resilient than a lot of people give them credit for.
In the future, the program will continue serving its community by starting a behavioral health facility in Morgantown. The facility will offer treatment for people with substance use disorders, mental illnesses, and more.
We're going to do anything we can because we really love our community.
Downey is part of that community, one of 25 million people in the U.S. in recovery. And she says she's committed to her work at West Virginia Peers for the long term. For West Virginia Today, I'm Laura Bonatesta in Charleston.
Recovery from addiction is possible. For help, please call the free and confidential treatment hotline at the bottom of your screen or visit findtreatment.gov.
While Americans are trying to move past the pandemic, a New York Times report says audiences are not yet returning to their seats at pre-pandemic numbers.
In fact, a recent study shows that ticket sales for live theater are down by about 20%.
So what does that mean, Bailey, for both local and national performers like those on Broadway?
Well, photojournalist Maya Lands and I take a closer look at the future of the Robinson Grant Performing Arts Center in Harrison County, as well as one local woman's dream about working in the industry.
The performing arts were booming pre-pandemic, and now... Okay, so maybe it's not that bad, but the program manager at the Robinson Grant Performing Arts Center, Jason Young, says making a comeback financially after COVID has been a struggle.
We were forced to close, and then it was about, you know, how do we maintain any sense of financial responsibility and ability to pay the bills, pay the people, keep the lights on, keep the heat running, because you can't just mothball this place, right?
Local theaters aren't the only ones affected by lower ticket sales at the box office. 143 theater organizations just like this one said their ticket revenue was down 41% throughout the 2021-22 season. Before COVID, it was only down by 30%. Young says his theater is looking at different strategies to bolster ticket sales and put customers in seats.
Christmas movies. We're doing the Polar Express, of course, Hot Chocolate and Pajamas. We're doing Feast of the Seven Fishes, which is a local film, and Bob Tennell, the director and writer, will be here for that one. And then on December the 23rd, right before Christmas Eve, we're doing White Christmas, which is sort of the tradition here, is to come see White Christmas. It's our last event before Christmas, our last event before the new year, and it's just sort of, it's the bow on the Christmas package that is Christmas at the Grand.
And it's not just local theaters that are struggling. Broadway offers the most obvious and stark evidence of diminished attendance and its economic consequences. During the 2021-22 season, which started slow and late as the industry gradually reopened, there were 6,860 performances seen by 6.7 million people, grossing $845 million. By contrast, during the 2018-19 season, the last full season before the pandemic, there were 13,590 performances seen by 14.8 million people, grossing $1.8 billion.
But I can tell you that any conversation I have with folks that are in a similar role that I am in across the nation, they're all seeing decrease audience attendance. They're all seeing decrease like season ticket holders, just a decrease across the board.
And it's not just the economic side of the performing arts that still is struggling. Dancer Jillian Winoski has dreamed of being a rockette since she was a little girl. The pandemic meant that Jillian has not had any in-person auditions since 2019.
And I've only auditioned twice in person, 2018 and 2019, so I've had 3 years off where they haven't seen my face. They haven't seen what I can do. So I'm looking forward to getting back to that next year, but it has been a weird 3 years of not having the opportunity to do that. I'm still young, but it feels like I'm kind of wasting those years away in a way.
Jillian has spent 15 years performing. In the past 4 years, she was a member of the prestigious WVU dance team. Add this to an average of 15 hours a week in the studio perfecting her craft, and you have someone determined to achieve her goal in spite of the pandemic.
Not many people are lucky to find what they love to do at such an early age. I mean, people play sports and do activities when they're kids, but not many people get to go all the way to adulthood with what they love. And I'm very lucky to have been blessed with this gift of dance, and for that, I try to remind myself every day that I am blessed to do what I do, and I shouldn't stop until I physically can't.
Despite pandemic obstacles, Jillian is not alone in her desire to audition to become a rockette.
Here we are going to start.
About 750 women travel to Radio City Music Hall in New York City in hopes of landing one of only 80 spots. Jillian will be one of those women in 2023.
The Rockettes have been entertaining audiences since 1925, Sean. But unfortunately, their audiences will likely be smaller this holiday season than in years past.
That's true, Bailey. Experts say it may take years for live theater to make a financial recovery to pre-pandemic numbers.
Sean, did you know that over the span of the pandemic, nearly 23 million American households brought home a pet?
And Bailey, Americans spent $42 billion on pet food and treats in 2020.
West Virginia Today reporter Carly Miner is in the studio to tell us more about pet adoptions during the pandemic and where those pets are now. Carly?
Thanks, Bailey. Sean, nearly 1 in 5 households adopted a pet during the pandemic. But as Americans returned to work and their social lives, some also returned their pandemic pets. Photojournalist Emily Kessler and I visited one local shelter to find out more. Animal shelters have been playing a vital role in our communities since the start of the pandemic, as they work to reunite pets with loving owners. The Humane Society of Harrison County has worked with over 100 residents to help provide for animals during the pandemic.
We were pickier about where the animals were going. We had more time to go over the
the application process, and we really just wanted to make sure if they were going to go home now, they were going to go home and stay home.
Frankie Dennison, director of the Humane Society of Harrison County, said the shelter was impacted in a way she was not expecting. She explained how there was an increase in adoptions, but as time went on, they saw an increase in returns as well.
We actually had a lot more of people applying for pets, basically because people were at home and they were lonely, and it was just kind of a way to get them in here and at least see what we had to offer.
Following the 2-year hiatus, Desiree Warner, an employee at the Humane Society, says they have been providing vouchers to the community to help with pet finances through the pandemic.
We do offer a low-income voucher that does help out with spaying and neutering. You would just take that to whatever veterinarian that you go to. And then all of the animals that we have here, we spay and neuter them, either before they go to the home or we have them come back so they can get spayed.
Over 6 million animals like this one are brought into shelters each year all across the United States. And while the pandemic caused pet owners' finances to decrease, a national report shows a 25% decrease in surrenders in shelters. But for these residents, they feel grateful for their newly adopted furry friend, especially throughout the isolation period.
And he was fantastic through all of that. It's really nice to have a buddy to cuddle up with and keep you busy, keep your mind on something when you're stuck in the house for that long.
One of the largest nonprofit organizations in the United States of America, nearly 14,000 shelters and rescue groups located in all 50 states. The shelter allows community members like Mary Clark a chance to connect with a new companion.
He was the first one to jump up on me and give me kisses, so out we went.
According to ASPCA, 1 in 5 households has adopted a cat or dog since the beginning of the pandemic. During that time, 90% of dogs and 85% of cats were able to find their forever homes. While pet adoptions has increased throughout the pandemic, the shelter hopes to continue bringing awareness to the long-term benefits of adopting.
Pandemic pet owners are also coming to terms with the true cost of adoption. When much of the workforce was remote, there was no cost for doggy daycare. Add in vet visits, food, and toys, and the average cost of owning a pet ranges from $700 to over $1,000 per year.
Thanks, Carly, for that report. Well, I, for one, couldn't imagine my life without my 2 dogs and a cat.
I feel the same way, Sean. I'd like to give a shout out to my cat Potter. He is my pride and joy, and he even does tricks. Well, that's going to do it for us on West Virginia Today. I'm Bailey Tucker.
And I'm Sean McAllister. You can watch us streaming at 11:30 a.m. this Saturday on the KDKA website. You can also check us out on West Virginia Public Broadcasting on Friday night at 8:30 p.m.
As well as watch our show on the City of Morgantown's Public Access channel and the HD Media website. Thanks for watching West Virginia Today.